If you're on Ozempic, Wegovy, Zepbound, or thinking about it, you've probably heard rumors about mood changes. Can GLP-1 meds trigger depression, or actually help it? Today we're breaking down what the evidence says, why it's complicated, and what to watch for. This video is educational, not medical advice. If you notice mood changes, talk to your clinician. If you have thoughts of self-harm, call or text 988 in the US immediately. GLP-1 is a gut hormone that slows gastric emptying, stabilizes blood sugar, and signals fullness. The medications amplify those effects for diabetes or weight management. Importantly, GLP-1 receptors also live in the brain, in regions involved with reward, appetite, and stress, so it's plausible they can affect mood. After evaluating reports of suicidal thoughts or actions in people on GLP-1s, the FDA's preliminary assessment did not find evidence that these drugs cause suicidality, but they continue to monitor. Despite that, product labels instruct clinicians to monitor for depression or suicidal thoughts, and to discontinue if these emerge. A post-hoc analysis from semaglutide weight management trials found no increased risk of depression or suicidality compared to placebo, and even a small reduction in depressive symptoms, though not considered clinically meaningful. A 2025 BMJ cohort study likewise did not find an increased risk of suicidality versus a comparator class. At least one observational study reported higher rates of diagnosed depression, anxiety, or suicidal behavior among GLP-1 users. Because it was observational, confounding is likely, but it's a reminder to stay vigilant. The European Medicines Agency's Safety Committee stated in 2024 that available evidence did not support a causal link with suicidal thoughts while continuing surveillance. So how could GLP-1s influence depression mechanistically? Think of three overlapping systems. First, reward and dopamine tone. If food feels less rewarding, some people describe emotional flatness. In vulnerable folks, dampened food-related reward may spill into overall motivation and pleasure. Second, metabolic and inflammatory pathways. Improved insulin sensitivity and glycemic stability can reduce irritability and brain fog for many, potentially easing depressive symptoms. Weight loss itself often improves sleep apnea, joint pain, and inflammation, indirectly helping mood. Third, the gut-brain axis. Changes in appetite, diet pattern, GI symptoms, and the microbiome can ripple into stress circuits. Nausea or dyspepsia is physically draining and can lower mood day to day. Where might we see potential mood benefits? Fewer food obsessions, which reduces mental load, more stable energy, which means steadier mood, weight-linked relief, as better sleep and mobility often support mental health, and emerging evidence suggests depressive symptoms can decline with GLP-1 therapy in some groups, though effect sizes are modest and not specific antidepressant treatment. Where could risks show up? New or worsening low mood or emotional blunting. Social withdrawal, especially if your social life revolves around meals. GI burden, since persistent nausea or constipation can wear you down. History also matters. Past depression, eating disorders, substance use, or high stress can heighten vulnerability. And using unregulated compounded products carries extra safety risks, including purity and dosing concerns. What's a simple monitoring plan? Before starting, write a baseline. Sleep, energy, motivation, appetite, and a 2-week mood log. If you're already in treatment for depression, include your prescriber. In the first 8 to 12 weeks, track weekly. Mood, sleep quality, interest and joy, social engagement, and GI symptoms. If persistent sadness, hopelessness, or suicidal thoughts appear, contact your clinician promptly. Labels advise stopping the medication if suicidal thoughts emerge. Sometimes adjusting dose, managing GI effects, or adding psychotherapy helps you stay on track. Here are some practical tips to protect mental health. Don't undereat. Appetite suppression is strong, so ensure enough protein, fiber, and micronutrients to prevent fatigue and mood dips. Keep social rituals, just adapt them if needed. Move most days. Exercise supports mood and counters anhedonia. Guard your sleep since weight loss can improve sleep apnea and overall rest. And always stay with approved medications, not gray market sources. Right now, there's no clear causal link between GLP-1s and suicidality, and some studies report small average improvements in depressive symptoms. But individual responses vary. Treat mood as a co-equal outcome, track it, talk about it, and adjust care early if it slips. If this helped, like and subscribe. In the comments, let me know. Have you noticed mood changes on a GLP-1, good or bad? Your experience could really help someone else.